I think there are a lot of things that can explain this, why there are pregnancies between ages 10 to 14. But basically, it can really tell us that child abuse and exploitation might really be present in those situations. For them to be really pregnant at that early age, then that would mean that there is something happening in their homes, in our society, in the community, and even in the entire country. So that would really lead us to really know what causes all these things. And there are a lot of risk factors. I think for child sexual abuse and exploitation that could be related to this having young people pregnant at an early age of 10 to 14. So I think there are a lot of factors that are leading to these pregnancies, and child abuse might be really one of the factors that could explain these pregnancies.
Yeah, I mean, child abuse, obviously, we take that into consideration, especially given that other number, that at least 6 to 7% of these teenage pregnancies involves father older by 10 years. So certainly that discrepancy alone paints us a picture. But talk about the window of time for which this survey was conducted. You mentioned that there were obviously many, many factors. So not to oversimplify, but give us a few factors that we can probably somehow relate to that window of time to which this trend was noticed. What happened and what was peculiar as factors in that period?
Well, in this period, of course, in 2020, we really experienced a pandemic. So we really don't know, no? Most of the children might be locked up in their homes with their abusive parents. So in general, even before the 2017, we've been already studying about teenage pregnancies. And there are different factors. Like, for example, in individual factors, we have those the children might have disabilities, mental health problems, or behavioral problems, like risk-taking behaviors that lead them to be exposed in the to be sexually abused. There are also a lot of factors in terms of relationship with the families. If there is lack of supervision, if there are poor parenting styles among the parents, or the family it is disintegrated, like one parent is absent or the father is absent, no, or even if there is a factor of having domestic violence inside the home. So even the presence of vices like alcohol, cigarettes, and drugs inside the home might also affect the child's behavioral problems, exposing them further, or even the problems within the family that exposing them to this abuse. No, in the community level, there are also a lot of things, like there are low education in terms of on the rights of the child, or even the comprehensive sexual education is really not within the reach of these children. So in the societal level, there are also a lot of factors like poverty, no, acceptance of wide age gap might even exist in our country. And again, there's a taboo to discuss sex or sexuality, wherein could also lead somehow to like prevent pregnancies if those things or factors are also addressed too.
Okay, doctor, where exactly does this happen? Does it happen within the home, within the neighborhood? And do you think the pandemic was a bigger factor as compared to social media, which was also brought up by our senators?
Okay. Well, in our data in the Child Protection Unit, the first perpetrators really for sexual abuse among children are lies inside the home. It's usually the relatives, like the uncles, and also even fathers are there. So, given that, no, the home is also might be the place where this sexual abuse happens, leading to pregnancy.
Speaking of social media, Senator Robin Hood Padilla was saying that disinformation online has contributed to this. Do you agree with that statement? Is it really disinformation or the lack of education?
Well, for me, education really plays an important role to prevent problems like teenage pregnancy. No? With correct or proper education that we provide with our young children, with our children and teenagers, I think most of our projects, or even most of the moral or the values and the rights of the child, can really be can help on preventing this. Teenage pregnancy. So in terms of the social media, we wanted that proper information will be circulating in the social medias, so as to help these kids know when they are abused or not, or know how to fight for their rights, and know where to receive services and counseling services. Especially, there are a lot of services already available in the country for teenagers, no, especially the 13 years old and above, or even the 10 to 12. There are services. So if this information will be the ones circulating in the social media, I think we can reach more children, and we can educate more children on how to prevent this teenage pregnancies or being pregnant, especially in the young population as early as 10 years old.